welcome everyone to today's meeting of the West Lothian Integration Joint Board Audit, Risk and Governance Committee. I am Tom Conn. I'm a member of the IJB appointed by West Lothian Council, and I chair this committee. Today's meeting has been webcast live and recorded, and the recording will be available on the web in due course. The agenda and reports have been made available on the internet. Following the decision taken by the IJB, all board members have been invited to attend today's meeting. Those board members attending today's meeting who are not members of this committee will have no right to move motions or amendments or to vote. IJB officers will present the reports. All members may then ask questions and discuss the issues. Committee members will then make decisions. Are there any apologies, Val?
Thank you, Chair. We have the one apology from an appointed member. That's from Councillor Tony Boyle. And unfortunately, Amjad Khan and Councillor Damien Doran-Timpson were unable to take up to this morning's invitation.
Okay, thank you. Are there any declarations of interest? Don't see anybody indicating they wish to come in. Order of business, I can confirm that there are no notice of urgent business. Therefore, the business will be conducted as previously circulated on the agenda papers issued. Can we confirm the draft minute of the meeting held on Thursday, the 18th of December? Thank you, George. Item 5, timetable of meetings.
Chair, I could just quickly mention that obviously the timetable of meetings is there for approval by the committee. It's very much in keeping with the pattern of meetings that we have always traditionally held, with all of them being online, but with the one being in person, which is usually the June meeting. So just looking for approval from committee this morning on that timetable. Thank you.
Okay. If members are happy with that, then we can agree that that is the calendar of meetings going forward. Thank you. Takes us to item 6, 2025-26 forecast outturn report by Chief Finance Officer Hamish.
Thanks, Tom. The report for the committee today provides an update on the 25 forecast outturn for the board. At Q3, the IJB is forecasting a £4 million overspend for 25-26, which is a deterioration of £1 million since the last update to the board. The main issue continues to be significant pressures within adult social care, where the forecast overspend has risen to £1.9 million of an overspend, driven predominantly by learning disability services, new high-cost packages, and increases in the complexity of existing care have resulted in a projected overspend of over £2 million in LD alone. On the health side, core services are forecasting a modest improvement due to vacancies and slippage in planned recruitment. However, prescribing remains a substantial overspend at £2.6 million, and acute set-aside services have worsened to a £2.4 million overspend, largely due to exceptional winter demand, leading to increased staffing and supplies costs across the range of unscheduled care services that the board commissions from NHS Lothian. Savings delivery is also down, with only 89% of planned savings expected to be achieved in year. Slippage, particularly across transformation measures, has contributed to the forecast position, with over £1 million of planned savings not deliverable this year. I would note that a lot of those savings we're confident of achieving them in full on a recurring basis, so in terms of 26-27. The board will rely on full drawdown of the remaining reserves and will need further partner contributions to break even. Both partners will now be required to fund residual overspends after the board's reserves have been exhausted. Looking ahead, the scale of recurring pressures means that the board will need to consider changes to service deliveries as part of the 26-27 budget, which will be presented to the board in a few weeks' time. Happy to take any questions.
Thanks, Hamish. Are there any questions? George?
Hamish, could you actually just outline for to hold reserves, what is the actual legal requirement or necessary requirement? I know a lot of the IJBs don't have them, have exhausted them. I'd be interested to balance that off with what we should be in, what position we should be in.
Yeah, so we have a reserves policy which was agreed in 2020. The target level of uncommitted general reserves per that policy is £2 million. As you've already noted, George, we're on track that there will only be a handful of the 30 plus integration authorities in Scotland that will hold any reserves at the end of this year. And I think in the current environment, the current financial environment, I don't think it would be feasible to try and set a surplus budget to try and create reserves, given some of the difficult decisions we're already faced with. But our reserves policy is to hold uncommitted reserves of £2 million. But I do not think that, given where we've been and given some of the difficult decisions we're facing, I think making additional difficult decisions to try and generate try and top up reserves is not feasible in this financial environment.
Okay, thanks for that. And my second question, if you indulge me, Chair, is how conversations are going with our primary partners. Obviously, there's a real requirement for them to effectively raid their coffers as well to try and make sure we get into a break-even position. How are the conversations going with the council and NHS Lothian, because that's going to be key to us getting to any position of delivering this year.
Yeah, thank you. So the recovery plan to break even in 25-26 was agreed by the IJB in December, and that was discussed and agreed with both directors of finance, and discussions are ongoing. I regularly catch up with both directors of finance. Recently, the focus has been more around 2026-27 and the budget for next year and the budget gap for next year. The recovery plan to break even for this year is well understood and expected, and obviously we are grateful that the partners will be making additional contributions to try and get us to break even in 25-26.
Thanks, George. Are there any other questions or are there any comments? Don't see any indications, colleagues, so can we note the recommendations set out in the paper? Takes us to item 7, Accounts Commission, Local Government in Scotland Financial Bulletin 2024-25. Again, Hamish.
Thank you. I'll try and be brief because this is really a covering paper summarising a report, so I'm not going to summarise the summary in too much detail. The paper summarises the Accounts Commission's Local Government Financial Bulletin for the financial year 2024-25. The paper highlights that councils received an increase in funding in 24-25. However, the sector continues to face significant and growing financial pressure. Across Scotland, councils identified over £200 million in recurring savings. However, they still faced a collective budget gap, and I suppose the key thing to highlight is that in 24-25, for the first time in over 6 years, the sector recorded an overall overspend against revenue budgets. Notably, around half of councils overspent on social care services that they deliver on behalf of IJBs. That amounted to almost £50 million across Scotland. Councils continue to rely heavily on reserves and one-off measures to balance budgets, an approach that the Commission consistently warn is not sustainable. Looking ahead to 25-26, and this is always the strange thing about the timing of these reports, you've just heard me talk about closing off 25-26. the national picture showed a substantial budget gap and in meeting recurring cost pressures. The key message for IJBs is clear. Recurring pressures are driven by rising demand and inflation, and they must be addressed through service redesign and long-term financial planning. Close alignment with Council and NHS partners has been crucial in preparing our 26-27, 27-28 savings programme. So as a board, Tom, we are trying to take forward our long-term financial planning and give ourselves a lead in terms of delivering savings and that service redesign. I'm happy to take any questions on the report or anything related.
Thanks, Hamish. Are there any questions, colleagues? Hamish, I've got a couple of questions. Some which I think both really unfortunately rehearsed before, but given we're looking back historically and looking forward to where we currently are. But if these reports by the Account Commission are continually coming out, highlighting the financial situation, it seems to be a reliance on the health service budget and council budgets rather than Scottish Government putting money into the public services. And I suppose it's how do we get out of this bind? Because we continually seem to be in a cycle of trying to, I don't know if you try to, but managing decline. And is that just where we are as far as public service delivery is? We're managing decline rather than anything else.
So, sorry, Tom. Your question is about, are we trying to manage decline in the public sector? I just want to be clear about the question. Sorry.
Yeah. I mean, we've heard this time and time again of the pressures on the finances, and there doesn't seem to be any support coming from the centre. So is it a public policy in respect to manage decline? And that's what you and other officers are really doing as far as IJB is concerned and Lothian Health.
I don't think I'm well placed, Tom, to comment on public policy and manage decline. I suppose what I would say is that we continue to face significant constraints on public sector finances. The high inflation we've seen over the last several years, combined with the continuing cost of living crisis, put all that in the mixer, along with our demographic growth, the fact that we have quite high levels of deprivation in parts of our community, all plays into the fact that we can, where we are in terms of our financial position, you can draw correlations with the prescribing overspend to some of that, with our social care overspends, particularly in adult services and older people services. I suppose what's clear from the report is around the need to continue to transform services. And I've certainly fed back to the Commission. Alison and I were part of a panel earlier in the year, but it's increasingly becoming about, in some areas, looking to have to maybe cease certain services, and that, just continuing to ask for transformation isn't maybe going to cut it soon. And just to clarify, I'm not saying that is where we are in West Lothian, but this paper is around all of Scotland. And I think the focus on prevention is welcome in terms of that reform piece, and how deliverable that is in the short term without sort of pump prime funding, without invest to save funding. My professional opinion would be challenging. Because if we're going to do prevention, we would need some funding to really go all in on it. But yeah, I wouldn't want to go commenting on public policy, Tom, but certainly on the financial picture, we do find ourselves in a sort of medium term over the last several years, as you've noted, in a really challenging position. And some of that is global.
Yeah, no, sorry, I didn't really want you to answer the question of public policy, but it just seems to be that the focus is on the health board and ourselves, but we get our funding centrally, so there needs to be a change in the circle that we're currently in. Can I ask about 4.4, where you mentioned about ring fencing, where ring fencing has increased from 21 to 24%. So that doesn't really help us as far as our flexibility in that case. Is that right? That restricts what we can actually do with the resource that we've got?
So the increase, so this report, just to be clear, this report is about local government finances. Obviously, local government are one of our two partners.
Yeah.
So the increase in ring fencing would reduce the flexibility for West Lothian Council. I suppose with an IJB hat on, Tom, I would quite like funding to be ring fenced for social care, because I am the CFO for West Lothian IJB. So I would like funding to be ring fenced for social care, the same way I would like funding to be ring fenced for community health priorities, as opposed to maybe going into other health priorities. So, but in terms of local government, increase in ring fencing reduces West Lothian Council's ability to manoeuvre money around, because ring fence money comes from the Scottish Government for a specific reason. That may be for education, it may be for transport, it may be for social care.
Yeah, okay. George, thanks, Hamish.
A couple of things to unpick there. First of all, this is all personal opinion, but I mean, preventative to me is a spend to save. If you don't prevent it, it's going to end up in the mainstream. Therefore, it's going to cost a lot more in the long term. So that I think that's something that can't be disputed, because it's been evidenced in other places. This is about finances for the council side of things. There's a general concern that NRAC and the funding models that are being used to distribute the resources does not recognise the population increase, especially in West Lothian at the present moment. There was a letter going to be sent to the government from West Lothian Council, and we were also going to follow that through from the chair. Has there been any responses to that, and what level of discussion is going on about trying to get a fair distribution model? Now, I know you can't answer that, Hamish, but maybe Tom, you may be able to give us a bit of feedback on that from the council's aspect of things.
We have been making representations, George, as you would expect, and have had discussions. And from the IJB's perspective, John as chair and me as vice chair, we wrote to the local MSPs and cabinet secretaries to seek a meeting with them to put over what our situation is, and indeed we had that conversation a week, 10 days ago. Sorry, George, I've lost track of time. To be fair, there was no promise of any additional cash, and given that the Scottish budget was about to be confirmed in Parliament, there would be a timescale which was going to be difficult, but we did agree in the longer term to have regular meetings and discussions to get over better what actually is the situation in West Lothian and what the local pressures are. As you mentioned previously, an elderly population, for example, that is where West Lothian is having pressures. So we'll, well, through John as the chair, we will continue the dialogue with them to try and get over the point that probably now will be post-elections, given one cabinet secretary or one MSP is not seeking re-election, one is. So maybe after the election period is finished, then we can engage with local politicians and put over their concerns about what the lack of funding is actually doing to the delivery of service, and indeed to our staff you're having to deliver services as well. I don't know, John, if you want to add anything to that.
Can I ask one? Sorry.
Sorry.
No, go ahead, George.
What representation are you putting to COSLA? Because they're the overarching body and they're the ones that are going to change the government mind. I assume that West Lothian, like Mid Lothian and all the Lothian ones, are trying to get COSLA to actually recognise the funding models are incorrect. And unless you get COSLA's approval, the government won't move. Are these conversations actually happening within the Financial Resource Committee within COSLA?
I think they are, George. I mean, I'm not party to them directly myself, but I think, like all councils, it would be to get COSLA to recognise, and I think COSLA do recognise that there are pressures on social care, and that's where in the COSLA manifesto there was a request for an additional, I think it was £1 billion to local government and to deal with issues there. So that engagement is taking place between COSLA and Scottish Government. To what effect? Well, I think we just need to see how that progresses. But I think that the discussions are taking place. John,
I think I would say that. Thanks, Tom. George, I think I would say from my perspective, there are a lot of representations being made, particularly around NRAC. So both at health board level and from the council level. But I think I agree with Tom. I don't see any movement on that until after the election. I think it's a topic that's being raised a lot, and you're probably right. We need more focus. From an IJB point of view, as Tom said, we're going to continue to raise these issues with our elected representatives and with Scottish Government in an attempt to try and get them to understand the situation we find ourselves in. But I think it's a good idea for us to try and align with COSLA and with the health boards. And I think there needs to be a much more joined up set of representations into government. But I think from an IJB point of view, we're trying to do that as well as we can. So all of the levers that are under our control, we're now using. As Tom says, we had, I'd say, a productive meeting with two of our elected representatives. And I think they went away with a better understanding of the problem we find ourselves in. But I think we do need to continually explain the situation that we have to government, to the, and do that in conjunction with the health board and with COSLA. So I think it's a good idea, a good suggestion. Thanks.
Stevie?
Thanks, Tom. John, I totally agree with you. I think we have to make sure that we're communicating with COSLA, because COSLA has to have some teeth in this. And I think the problem that we do have with COSLA is at the moment there's too many SNP-led councils who are probably not going to bear their teeth to the Scottish Government at the moment. And I agree with Tom's opening comments that, I think the Scottish Government want to centralise everything at the moment, apart from the responsibility for local services. I don't think they're even pretending about the size of the public sector now. I think one of the quotes for one of their ministers was that there was 11,000 people that they want to take out the public sector. So to do that, that is going to have an impact on it's going to have an impact on my members, council staff. And there's nothing more frustrating for council officers than having to manage the decline that Tom was talking about, because that's what it is. It's a battle every day, and the morale of the staff, it just plummets every time we have discussions about cuts, about reorganisation, and it just means that people start looking for jobs elsewhere. And that has an impact on the staff, which has an impact on services, which ultimately has an impact on the service users.
Thanks, Stephen. Is there any other questions or any comments? And if not, can we note the recommendations set out in the paper? Oh, sorry, Peter.
Yeah, sorry, a bit related. It's just a more detailed question, really, just tying the discussion we had earlier about the outturn for this year in West Lothian versus this more general issue. I kind of picked up from Hamish that a lot of the cost pressures have been identified is in the learning disability side. I suppose that's compared with what you were predicting or projecting. Do we know anywhere, I'm not sure it's in the actual report for Scotland, whether in fact that's a general issue, sorry, that the costs in learning disability in particular are rising proportionately higher than elsewhere. And if we do know that, is there any argument for trying to encourage COSLA even to consider whether we can find a more general approach to supporting people with a learning disability that might ease some of the cost pressures without reducing the service? It's just a kind of, I'm just looking for options here that might solve the problem even in the shorter term.
Hamish.
Yeah, thank you. So yes, learning disabilities across all the IGBs is a significant financial pressure. This year we have started to try and collate information on a client group, service group level when we're doing the overall Scotland IGB finance returns. At Q1 this year, there's an approximate overspend across LD across Scotland of £30 million. That was at Q1, so it's quite a bit out of date, but it just gives you a bit of a flavour. And if you think about our positions deteriorated since then, I would assume that that has been the case across Scotland. I suppose just to dig into that a little bit, we've seen like fantastic developments around learning disabilities over the last few years in terms of for people in their own homes, in their local communities, whereas previously a lot of people would have required to essentially live in hospital for long periods of time. The flip side of that is it is often for our most complex citizens, it's often more expensive to have people in their own home, in their own community than it may be previous. Now that has obviously not stopped us from doing the right thing for people and their families, but that would be a sort of key change over the last maybe decade or more in terms of what we're able to provide the community, leading to those cost pressures, as well as some of the demographic changes we're seeing, comes across through all clients. In terms of lobbying through the CFO network, certainly, and so I've been invited to speak to the Accounts Commission. We've been very clear, and also in conversations with Scottish Government, we have been very clear that adult social care services are facing significant financial pressures, and a lot of the focus can often be on older people services because of the links to the general hospitals in terms of A&E performance and delayed discharges. So we've certainly been lobbying hard in terms of for a focus on not just learning disabilities, but also mental health and physical disabilities in conversations with partners and with external stakeholders. I suppose the last thing just to finish on is there anything we can do locally around service redesign or thinking about doing things differently? We have really good networks in place within Lothian. Alison, our Chief Officer, chairs the Learning Disability Collaborative across Lothian, or is about to start chairing that again, which brings together all the learning, these senior managers and learning disability strategy people across Lothian to think about, what can we learn from each other, and are there models that we can apply across the Lothians. Apologies if I have missed anything, Peter, or if I've went into too much detail.
No, that's helpful. I suppose as you were talking, I realised, I suppose, what my question was, can we break this? We can look at it in macro terms, that we don't have enough funding and who's responsible for that. Perfectly valid questions, but can we break it down into smaller chunks that we can, make progress on? And I think your answer's yes, that we are looking at that as a possible way forward. So yeah, thanks very much. Thank you.
Thanks, Peter. Hamish. John?
Thanks, Chair. I don't know if this is the right place to raise this, or maybe we want to raise an action from this committee to send on to the full board. But I just wondered that Hamish mentioned the CFO network. We've got the Chief Officers network. And I just wonder if there's a need for some form of collaboration or partnership to ensure that coming from a broad constituency and the messaging is getting up to government. We're doing what we can from an IJB level, as Tom has said. I'm just wondering if there's a need for the conclusions that are coming from the CFO network to work with the Chief Officers network. Then I don't know, it's almost like a coalition of the willing, go into COSLA and try and come up with a consensus set of positions that we can then, as a large collective, take to government. But as I say, maybe this is a recommendation from this committee up to the main board, and then the main board can have a discussion about any approach that we might like to take. Thanks, Chair.
Alison? You're on mute, Alison, or something, if you're not.
Turns out I have two separate mute buttons and I'd managed to only turn one of them off. Who knew?
Right.
So we, I think that already happens, John. I think we've also got much closer working relationships between the Chief Officer Network, the Chief Finance Officer Network, and with the chairs and vice chairs for IJBs. We've been doing a lot of work within Health and Social Care Scotland to try and ensure that we have that one collective voice and that we are adequately representing across those groups, which also means that we're able, through those different networks, because we have different links into both COSLA and Scottish Government through those, that we're able to give that strength of voice and do some of that collective information. I think the fact that Hamish earlier on was able to tell Peter what the overspend was across Scotland for learning disability, I think really shows some of the work that is happening collectively so that we can have that, I suppose, collective and one voice in amongst it. And I suppose it might be, I suppose that I don't know how, I've never asked Tom and John how closely linked in you are to the chairs and vice chairs network and how you use your voice within that network to make sure that we're doing that. Because certainly Health and Social Care Scotland is trying to coordinate those voices, those messages, and how we can best use the different areas of influence that we have with Scottish Government, with COSLA, more widely in the conversations that we have. So yeah, I think that is already in place, John, and I'm not sure there would be another action required from West Lothian's perspective.
Hamish?
Yeah, just to build on that, COSLA are members of the CFO network. They regularly attend. Scottish Government are members and regularly attend what we call our public session. And we've also been trying to build closer links with both Accounts Commission and Audit Scotland, as well as CIPFA, the Chartered Institute of Public Finance and Accountancy, are members of the group as well. And we've been doing work with them around their local government information unit and learning from the NCS. So I would just back up what Alison says in terms of, we have a good lobbying voice and the message is heard loud and clear. I suppose the bit is enough, what is going to happen off the back of it. We're still facing a constrained funding envelope.
Thanks, Hamish. Are there any other questions or comments? And see any indications? In that case, colleagues, can I suggest that we note the recommendations set out in the paper? Thank you very much. Takes us to item 8, Internal Audit Plan 2026-27. Stuart.
Thank you, Chair. This report sets out the IGB's proposed internal audit plan for 26-27. Internal audit work is subject to global internal audit standards, which are recognised standards and practices regulating the conduct of internal audit in the public sector. Responsibility for an effective system of internal control rests with management, and the purpose of internal audit function is to provide assurance that controls operated by management are in place and effective. The global internal audit standards require that a risk-based internal audit plan is prepared, and in preparing the IGB internal audit plan for 26-27, I have reviewed the IGB's risk register, and I've also reviewed their previous internal audit work. So the 26-27 plan is as follows. An audit review will be undertaken of the key controls of budget monitoring and financial planning. This is recorded in the risk register as risk IGB 007, currently assessed as high risk, and the area was last subject to audit in financial year 21-22. There's also time in the plan for follow-up of previous internal audit work of workforce planning and performance management. Both audits are currently in progress, and full reports will be brought to the committee in due course. So, Chair, the committee is asked to approve the IGB's internal audit plan for 26-27. Happy to take any questions.
Thanks, Stuart. Are there any questions, colleagues? I've got one, Stuart, just a wee technicality just for my more clarification. But given we've got two organisations, is there a different methodology, systems of doing internal audits, or is it more or less pretty standard of what are the issues that are investigated, reported on and addressed as necessary?
Thank you, Chair. Yes, and in terms of the methodologies of both our internal audit and we work closely with the NHS internal auditor. It would be our plan this year for the internal auditor from the NHS side to conduct the budget monitoring audit, and ourselves we would conduct the follow-up audits. That agreement and protocol has worked very good in the past, but at the same time we keep in close contact with the NHS auditor and liaise during the audit with any findings that take place.
Thanks, Stuart. Are there any other questions, colleagues? If that's the case, can we approve the recommendations set out in the paper? Paper 9, External Audit Plan 2025-26. Hamish.
Thanks, Tom. So the report is to inform the committee of the External Auditors 25-26 audit plan. The committee are asked to consider the plan. The fee for this year is a 4.35% increase on last year's fee. But I'll hand over to Claire Gardner from Audit Scotland, who's here to present the plan and take any questions about the plan. Thanks.
Thanks, Hamish. Yeah, this is the plan for the fourth year of this current audit appointment. So we have one more year before rotation. It's my personal third year. Hopefully everyone's fairly familiar with the content of the plans and the format of them by now, but I will draw out some key information. So materiality is highlighted in Exhibit 1, and this is the level on which we base our conclusions. So anything above 7 million, we would ask for the accounts to be changed and an adjustment to be made before we would think about a qualification. Anything above 354,000, we would bring to committees members' attention. Anything below that level we would discuss with management, but we do deem it to be trivial, so we wouldn't raise it with committee members. We've highlighted significant risks of material misstatement in Exhibit 2, and we have only one. It's management override of control. It's just to reassure members that this isn't a specific risk that we're finding at the IJB. This is a risk that appears on every single audit plan everywhere, whether they're in the public or private sector. So it's not that we found anything untoward at the IJB. This is a risk that's required by ISAs. We also conduct work in relation to wider scope and best value. We've identified one audit risk in relation to the wider scope over financial sustainability, and that just really reflects some of the discussions we've been having today about the challenging financial landscape and pressures. So hopefully that comes as no surprise. We've set out our timetable. We did have in the table that it would be a date in September, which was to be confirmed. That has now been confirmed as part of this meeting through the timetable. So it will be the meeting in early September. We will be signing off the accounts. As Hamish has highlighted, the fee for this year is 35,000, which is an increase. This is a standard risk increase across all Audit Scotland clients, and it's dealt with centrally through our our audit quality and appointments sector. We do have scope to raise the fees if we deem there to be a significant risk at clients by up to 10%, just to assure you that we've not done that to date with the IJB, and we would only really do that if there was a significant amount of audit work required. We don't anticipate that, so we will be setting it at the standard level. That was all I wanted to highlight. I'm happy to take any questions on the report.
Thanks, Claire. Are there any questions, colleagues? George?
More a comment than anything else. We had a very clean audit last year, which was very pleasing, which we didn't actually highlight any major risks. Again, the one that you have highlighted is the sustainability side of things. Will you give more detail to that in the actual final note? Because I think we need to really highlight how we cannot afford to carry on the way we are with the resources we have. We've had that discussion today, so it would be good to see that in the internal audit, with the external audit as well, highlighting the challenges that we face.
Yeah, we will provide a lot more detail on that in the annual audit report. I think last year we did flag the significant risk that the IJB would not be sustainable in the longer term. So we have used quite robust wording in our plan. I suppose it's also worth highlighting that you've just had the local government overview report. There has, in the last 7 days, been an IJB overview report presented by the Accounts Commission and the Auditor General. It's a joint report which comments on some of the issues you've been discussing specifically for IJB. So I expect Hamish will probably bring that to the next committee. You just missed it because it has literally been within the last week that it was brought out, and that highlights some of the significant issues and the diminishing of reserves across all IJBs as well. So hopefully those reports will reflect the challenges.
Hamish?
Yeah, I suppose just to confirm that, yes, my intention is to bring that report to the June meeting of the committee. The papers for Audit Risk and Governance Committee were literally issued half an hour before the Accounts Commission released that report. So it was unfortunate that we weren't able to bring it to this meeting, because it would have been timely, given we're about to set a budget for next year. But I think some of the learning and the lessons and some of the read across Scotland, which I think members find helpful in terms of what's going on across the country, is always valuable. So I'll do a detailed report on that to the June Audit Risk and Governance Committee, and I'm sure we can circulate it to the wider board if that would be helpful.
Yeah, that would be good. Yeah. Can I just ask a general question to, I suppose it's Alison and Hamish, that the timetable set out, that you consider it to be achievable, that Claire's not asking us to clear the decks for you to try and reach a deadline that you don't think is achievable. That's no criticism of Claire on that basis. Hamish?
I mean, it's probably worth noting that Audit Scotland are an incredibly hard taskmaster. But no, not at all, Tom. The timetable is perfectly reasonable from my perspective, and we've always, touch wood, in West Lothian, we've always been able to keep with the deadlines, and we've always had a clean set of accounts, and I wouldn't expect that to be any different this year. But Claire and her team do work me very hard throughout the summer months, just to give John in particular some assurance that I'm always very busy with the IJB.
Right, thanks, Hamish. Thanks for your report, Claire. Can we note the recommendation set out in the paper, colleagues? Which takes us to item 10, integration joint board risks. Alison?
It's myself, Tom.
Was it your, sir? Beg your
Yeah.
pardon.
No problem at all. I'll take this. So, in accordance with IGB's approved risk management strategy, all of the IGB's risks are reported to this committee twice a year. There are 10 risks in total, and the same number as reported to the committee back in December. The IGB has 8 risks, and there are further 2 operational risks owned by West Lothian Council, which are also reported. In total, 4 risks are assessed as high, 2 are medium, and 4 are assessed as low risks. High risks are defined as risks going 12 or more, and 4 high risks remain unchanged from December. These are risk IGB 006, delayed discharge, IGB 007, inadequate budget resources to fully fund delivery of the strategic plan, risk IGB 008, failure to effectively implement the strategic plan, and West Lothian Council risk SPCC 005, increasing expenditure on commission care services for adults and older people. Details of each of the 10 risks is 1, and Appendix 2 sets out the risk assessment methodology. Chair, committee is invited to scrutinise these risks. Happy to take any questions, as would the other officers present.
Thanks, Chair. Are there any questions, colleagues? George?
But obliged to ask the question because it's the same position we were in last time we actually discussed this matter. You know, this risks are significant in the 006 through to 8. That's all financial. Are we confident that we have mitigation in place to try and deal with the risks in the longer term? And if not, what else can we be doing to actually mitigate some of these risks, Stuart?
Do you mind if I take that, Tom?
Yeah, sorry, Hamish.
Yeah.
Yeah, sorry.
Yeah. So yeah, it's a very good question, George. So in terms of the mitigations, we have several mitigations in place that are, you know, against IGB 007, which is the highest risk. We've also got the other high risk around the social care overspend, which is also a council risk. I suppose the timing of these risks is just before the budget. At the minute, they are both still scoring the highest they can. In terms of what are we doing about it? Well, part of the reason that we will be bringing a 2-year savings program to the board in a few weeks' time is to try and manage that longer term financial sustainability. So the Scottish Government has only set a 1-year budget, which obviously is, you know, Scottish Government budget is the main thing that affects both our partners. So it affects us in terms of we only get a 1-year budget offer from West Lothian Council and from NHS Lothian. But in keeping with, you know, everything we've discussed this morning about the IGB's long-term financial sustainability challenges, we will be bringing forward a 2-year savings program to be agreed in March, because we recognise that a lot of those savings are around significant service redesign, and we need a lead time to deliver those services and, you know, to do the appropriate consultation with staff, with trade union, with partnership. So that would be the sort of key relevant one right now is that we're doing a 2-year savings program, and that we'll also be looking to, you know, kick off some reviews as part of a longer term budget strategy, which is in keeping with what West Lothian Council agreed as part of their budget. We need to be planning for the long term, given the demand and demographic increases we're seeing now. The council were not limiting it to any services, and I don't think we should either. I think we should be, you know, agreeing our budget and our 2-year savings program, but also asking officers to go away and do reviews for the long term, because the outlook for the public sector finances continues to be constrained. Happy to take any other questions, or if I've not answered anything.
Thanks, Hamish. Okay, can I ask regarding SPCC SPCC 05, is there any additional internal controls that could be put in place to effectively reduce the risk though? Robin?
Thank you, Tom. So the internal controls continue to be reviewed on a monthly basis, Tom, to really consider if there's anything further that we can add to them. One of the significant elements that we'll be looking at is the impact, obviously, of the council budget setting position that took place in February, alongside the activity of the savings measures that are going to be progressed across at the IJB meeting later in March. That would be probably one of the key controls that will be relevant to the overall risk rating that we have at this minute in time, given it's reflected at its maximum score rating in the papers before the meeting today. That would be another internal control that we'd be looking to reflect and will be reflected in the risk score moving forward. Thank you, Chair.
Thanks, Robin. Any other questions? Stephen?
Thanks, Tom. I'm getting my Sunday name, Stephen. Thanks.
It's interchangeable, Stephen, depends.
Robin, can I just ask what it means by robust review and approval process in place of all care requests by senior managers to fully ensure that alternatives to formal care have been fully considered? What does that mean, Rob? What do you mean by formal care? Sorry, I suppose is the shortened question.
Thank you, Chair. So there's obviously a few bits and pieces in there. If you're specifically asking about formal care, as opposed to the approval processes that sit above it, the formal care is referring in the main to how we allocate care at home provision or indeed residential provision or nursing home provision for individuals. What we're trying to do is obviously support the home first principles that are the key strategic aim of the IJB, and utilising anything that we can in terms of individual strengths that either the individual has themselves or indeed their families or communities around them. Examples of that might be some of the strategies such as technology enabled care, how we support people, other elements such as perhaps how we support carer breaks, how we support people to access other provisions within the community, and making sure that we are looking at the entire person and their community around them, as opposed to the immediacy of increasing a care at home package of care, or indeed someone perhaps going into a very expensive residential resource. So it's just about making sure that we are targeting our available resources in the most efficient manner and making sure that we build on people's strengths wherever possible. Workers across the various teams have been provided with support in relation to good conversations as to how they support that, and have the support of senior managers in terms of how plans are developed, reviewed and approved. Hopefully that addresses the question, Chair. I'm happy to speak further if it's helpful.
Okay. Thanks, Robin.
Thanks, Rob.
Okay. Are there any other questions? Are there any comments? In that case, can we agree the recommendations set out in the paper? Thank you. Item 11, self-assessment questionnaire. Dan?
Thank you, Chair. So the purpose of this report is to consider the arrangements for carrying out the periodic self-assessment of the committee's administrative arrangements and activity, and to approve the questionnaire within the appendix for issue to members. It's recommended that the committee consider carrying out the annual self-assessment of the committee's effectiveness by the use of the questionnaire in the appendix, and secondly, to agree the questionnaire being issued to members and the results reported to the June meeting of the committee. So the SIPSA framework under which the board's Code of Corporate Governance was developed suggests that committees involved in scrutiny and internal control should periodically conduct a self-assessment of their effectiveness in operation. The aim is to involve members in close consideration of the role of the committee and its members, its administrative arrangements and the context in which it operates. A questionnaire was originally developed for the board's Audit, Risk and Governance Committee. It is based on examples used in other public bodies and councils and was first approved for circulation in March 2018. It has been conducted annually since, with a similar self-assessment being developed for the IJB on the recommendation of the external auditor as part of the annual governance statement approved for signature and publication by the board on the 24th of September 2018. No changes for the questionnaire are proposed this year, and the draft questionnaire is attached to Appendix 1 for the committee's approval. It's proposed that the finalised questionnaire will be circulated to members electronically for completion. The results will be anonymous and will be summarised and reported to the June meeting of the committee. Happy to take any questions.
Thanks, Dan. Any questions, colleagues? No. I've got one, Dan, and it's the same questionnaire that we've issued previously. So do you see the benefit of issuing the same questions on an annual basis for a consistency basis, or should it maybe be adapted to reflect maybe comments made previously by members? So is it consistency that we're looking for in asking the same questions?
Thanks, Tom. I think in terms of consistency, I guess with issuing the same questions as last year, we may see whether there's been any changes in sort of opinion or thoughts around how the committee's driven forward and the work that they're doing. Equally, if there's any feedback from members that they want any questions altered or changed, then I'm happy to take that on board. I guess this is what this item is for, is to sort of just check that everyone is happy with that questionnaire. And if they want any amendments, we can look at doing that.
Yeah, no, that's fine. Thanks to you. George?
Very much in the same line. I think one of the questions should be, these questionnaires going out, the relevance of them, and actually what could be changed within the document. That could be a direct question to them. And the other one that will probably affect you more than anything else, just chasing people up to complete them and get them back in time. That seems to be a real problem, to try and get members to engage and actually return them. So that I think we need to be a bit more specific and make an instruction to members that they have to be part of this process. It's not a voluntary thing, it's very much an important part of this process, that we are well cited and have evidence-based information with this contained within the questionnaire. So it's more to try and push that message, because I think last year I had to put out 2 notice to try and get members to actually come back in and actually complete the questionnaire. So just to emphasise that point.
So you want me to be harsher in the way in which members are approached?
Stand on them, Chair, stand on them. Make sure they get involved.
Okay, noted, George. Yeah, I think you're right about the value of it. Yeah, and thinking back, I may have been one of the persons you had to nudge a bit. So I take that on board. Okay, if there's no other questions or comments, can we agree the recommendations set out in the paper, which takes us to the work plan? And can we note the work plan? Don't see anybody coming in. So on that basis, colleagues, that concludes today's business. Thank you.